Madam Chairman. And Dr. Schuchat, let me join the chorus. Thank you for 33 years of remarkable service. I have a question for
Madam Director, could you in 1 minute summarize for me what the recommendations are today from your agency about wearing masks?
Last Thursday, we released guidance that demonstrated for an individual who is fully vaccinated and not immunocompromised, that they are able to safely unmask, with the exceptions, certain exceptions, of course, in travel corridors, healthcare settings, that if you are an individual, you can safely unmask if you're fully vaccinated.
Inside and outside?
Inside and outside.
Okay.
For you in a minute, but I want to start with a little different approach. And let me say that.
What about airplanes?
What is the policy on airplanes? The policy on airplanes is to wear a mask.
Okay. And why is it different on an airplane as opposed to a restaurant?
So the CDC provides guidance for what is safe to do. The federal policy is obviously an interagency policy that we need to look at across different agencies. What I will say, though, is that there's very little choice when you board an airplane as to who's going to be sitting next to you, who's around you. And also, airplanes may be a place where we have more variance because of the travel from international places.
I'm wondering when we can expect perhaps more detailed guidance for workplaces such as meatpacking plants and other crowded facilities where there's going to be a mix of vaccinated and unvaccinated workers.
Our National Institute of Occupational Safety and Health is working closely with OSHA around getting the best science to the Department of Labor, who has regulatory authority, but we are at CDC updating our guidance for the particular settings in light of the newer science.
Because they were saying, well, why should I get vaccinated if I still have to wear a mask? So thank you for that. Is this unnecessary for governors and mayors across the country to still keep a mask mandate in place?
One of the things I think that's really key in this is to recognize that we're not a homogeneous country, that there are some areas, that some counties that still have less than 20% of people vaccinated. There are some counties that still have greater than 100 per 100,000 cases in a 7-day period of time. And so I actually think, as I look at the map, a very heterogeneous map of how we're doing with cases, how we're doing with vaccinations, the decisions about whether to take off a mask mandate have to be made at the local level, have to be made at the community level. There are still some communities who are suffering. We know African Americans lost 2.9 years of life compared to white Americans losing 0.8 years of life. We need to make sure that, and they are probably the communities that got access to vaccines last. We're working on that. We've had extraordinary improvements in our access to, in our racial and ethnic minorities having access to vaccines. But I do think that these need to be made at the local and community level for exactly that reason.
For that. But I do have a question.